HIV infections have grown by over 20% since 2010. And that is very, very dangerous.
En 2018, plus de 50 000 Canadiens vivaient avec le VIH, mais des milliers d'entre eux ne le savaient même pas.
Canada has committed to ending HIV as a public health threat by 2030, but is falling behind other G7 countries.
And not all communities are affected equally.
Black and Indigenous people are overrepresented among new HIV infections.
Les hommes gays demeurent les plus affectés, mais les chiffres augmentent aussi chez les personnes hétérosexuelles, les personnes qui utilisent des substances et les personnes incarcérées.
In 2019, the federal government introduced a new action plan to address HIV and other STIs.
There was no funding attached to this plan.
Plus de 123 millions de dollars promis pour répondre au VIH depuis 20 ans n'ont jamais été versés.
Organizations that provide direct support to people living with HIV have had to close their doors.
The House of Commons Standing Committee on Health has called for $100 million annually to fund the HIV response.
It's time for the federal government to put its money where its mouth is.
It's time to call on the federal government to adequately fund the community-based HIV response.
You can help.
People living with HIV and people who work on the HIV front line across Canada are raising their voices and demanding more.
Will you help us? Sign a letter to the Minister of Health and help stop the underfunding of the HIV response in Canada.